Person, a history outside of diagnosis. What is personhood? Personhood is what makes each of us a unique human being. It includes all the dimensions of a person that make him or her feel whole. Personhood respects an individual in all aspects of their life, from their strengths, their weaknesses, motivations, dreams, family, and life experiences. The concept of personhood takes into account all the dimensions that make the person who they are. Personhood involves treating a person outside of their diagnosis and focuses on who the person is rather than their medical condition, the tasks to be done, or the medical pathology. It creates understanding of a person on a human level. It can be easily remembered by the acronym HISTORY outside of diagnosis. Let's take a look at Benjamin's story. What are your impressions of Benjamin?
Benjamin is an 82-year-old male recently admitted to Queen's Park Care Center. He has a history of dementia and has been known to act aggressively. He was also diagnosed with COPD 5 years ago and fatigues easily. As a result, he utilizes a wheelchair for ambulation. Prior to his admission, he was living with his daughter at her home in Richmond. As his dementia has progressed, his care also became more difficult to manage. As such, he now depends on others to provide care for him.
Were your impressions similar to the text shown? Would knowing more about the resident change the way you provide care?
Hi, my name is Ben. I'm 82. I was born and raised in North Vancouver, middle child of 3. I've had some great moments, but I've also seen many hardships throughout my life. I was married to my wife Iris for 47 years. I had 2 children, a daughter and a son. I worked as a firefighter for 30 years. I lost my only son who drowned when he was 12. I lost my wife 10 years ago to cancer. I'm here now alone. I know I can't take care of myself. The cigarettes have finally caught up to me.
What are your impressions of Benjamin now? Has your first impression changed? What is dementia? Dementia is a chronic or progressive disease of older people resulting in impairment of higher brain functions. Potentially, it can affect memory, thinking, understanding, reasoning, comprehension, language, and/or decision-making. What is aggression? Aggression is a hostile action directed towards an object, others, or self. It can be displayed as verbal and/or physical actions, which can include agitation, restlessness, threatened aggression, self-abuse, and physical injury to others. What are some causes of aggression? Some potential causes of aggression are imposing on personal boundaries, such as when providing personal care or baths, uncommunicated needs, such as hunger, toileting, or unexpressed feelings, being frightened, loss of inhibitions, loss of awareness for rules or appropriate behavior, all of which are related to the illness process, and finally, being disrespected or hurried. Lately you notice that Benjamin is restless with the upcoming swimming pool excursion. You wonder what could be the cause of such agitation, and in an effort to try and calm him, you decide to talk with him in his room. You sit nearby. The conversation starts off innocent enough, as you chat about how he will be able to participate at the event. You mention that he would enjoy swimming, and mention that it is safe, and there are people there who will help him out. You notice a change in his body language as he tenses up. He verbally responds by yelling, "Get out of my room!" and throws a nearby coffee mug at you. The event was certainly a shock. Perplexed, you back off and think.
There are several techniques that can be used to manage aggressive behavior in residents with dementia without using pharmacological methods, medications, or the use of restraints. Pharmacological methods are not recommended for use, as they are considered chemically restraining, result in an increase of falls, as well as an increase in adverse effects. The drug class antipsychotics are also known to increase cognitive decline. Restraints are also not recommended for use as they reduce patient autonomy and the ability to make personal choice, have the potential to increase aggression or fear, and can be abused in terms of controlling patient behavior. The recommended non-pharmacological approaches are behavioral, environmental management, reality orientation, and personhood or person-centered care. The 4 non-pharmacological methods will be discussed further.
Behavioral. One way to reduce aggressive behavior is the use of the behavioral approach, which requires staff to be consistent in the ways in which they respond to a patient with dementia. This creates routine for the resident and knowledge of what is expected. Environmental management. A second technique for reducing aggression is the environmental management approach, which requires understanding of the triggers for stress within the physical environment, which can cause aggression. This will provide a safe, home-like setting that will minimize confusion and allow the resident to adjust to the environment. A supportive physical environment positively impacts the quality of life of both residents and staff. In promoting a positive environment, this reduces the potential triggers for aggression. Reality orientation. This involves talking with the individual and presenting information to them about themselves, who they are, present time, and present place. This allows for the resident to recognize their current situation. This technique is commonly used and allows for improved outcomes with the resident. While these techniques previously discussed are all readily used in the residential care environment, the technique promoted by Fraser Health is one that reflects personhood. Personhood.